In this class, we'll discuss regarding mitochondrial disorders and the eye. So we'll discuss regarding the mode of inheritance of these disorders, the genetics of these disorders, and how to diagnose these disorders, and the examples of mitochondrial disorders, and the treatment strategies for these conditions. So now coming to what are the mitochondrial disorders. So mitochondria are So what are mitochondria? Mitochondria are the powerhouse of cell. That is, it produces energy for cellular metabolism. Therefore, it plays an important role in the integrity and survival of cell. So coming to the genetics, the mitochondrial disorders can be divided into primary or secondary. The primary disorders, there is direct impairment of mitochondrial function by genes which are located either in the mtDNA or nDNA. Okay, and the secondary mitochondrial disorders, they result from environmental factors or other genetic disorders which cause oxidative damage. So the examples of this secondary are diabetic retinopathy, ARMD, and glaucoma. Okay, so these are the classification primary and secondary mitochondrial disorders. Now coming to the primary mitochondrial disorders, the genetics of these primary. So we said mtDNA and nDNA. This mtDNA has maternal inheritance. That is, it is transferred from mother to the child, whereas the nuclear DNA, it is either autosomal recessive or autosomal dominant, right? So coming to how it is involved. So if the mother is affected, then all the children will be affected, whereas if the father is affected, then it is not affected in children. Okay, so this is the pattern of maternal inheritance. So coming to the examples of these, so we have dominant optic atrophy, DOA. So in this, retinal ganglion cells, the retinal ganglion cells and the nerve fiber layer are affected. So it affects in the first to second decades of life, and it is due to optic atrophy 1 mutation. So on fundus examination we can see there is sectoral pallor of the optic nerve and NRR thinning. Then we have the most important one, most discussed one, that is leber hereditary optic neuropathy, LHON. Okay, so this disease, the mutation is in the mitochondrial respiratory chain complex 1 subunit genes. So it is the MTND4 gene at 11778 codon. So this is the most important one which is seen, and it affects usually 15 to 35 years males. Females are the carriers, right? So it presents with the triad of, so they present with optic atrophy, so in late cases, and in the presenting symptom is unilateral papillitis, so it becomes bilateral within 2 months. Okay, so we have the natural history of this disease. So there is primary mitochondrial DNA mutation. So this causes impaired mitochondrial oxidative phosphorylation, which increases the reactive oxygen species inside the eye. So this cause oxidative stress, and there is loss of retinal ganglion cell function. Then there is loss of retinal ganglion cell itself, which cause terminal visual loss. So there are some external factors which also cause this impairment of mitochondrial oxidative phosphorylation. So this is by the secondary etiological factors such as smoking, alcohol. Okay, so this is important because it helps in the treatment planning. Okay, so coming to the triad of presentation, as we said, they present with the papillitis and optic atrophy. So in the early stages it will present as telangiectasias. So there are telangiectasias, circumpapillary telangiectasias, microangiopathy. So this is circumpapillary telangiectasic microangiopathy. and there is pseudoedema and absence of leakage on FFA. So that's why this is pseudoedema. So these are the triads. Coming to the treatment strategies, so it depends on the natural history, right? So first thing, we have to stop this secondary etiological factors, and so because it's a mutation in the DNA, we can focus on gene therapy. So what are the foci of this? So we can focus on ND4 gene, and so here there is mitochondrial oxidative phosphorylation which is impaired, right? So we can also try antioxidants. So the ones which are used are idebenone. So it is given 900 mg OD, and we have vatiquinone and coenzyme Q10. Okay. Then we can also look about this neuroprotective agents like brimonidine. So these are all under trial. Cyclosporin A in vitamins. So in case of female carriers, you can think of hormone replacement therapy because estrogen is protective for retinal ganglion cells. Okay. This was regarding the treatment part. So we'll discuss regarding other disorders. So we have cpeo, chronic progressive external ophthalmoplegia, that is cpeo. So there is deletion of mitochondrial DNA. So on the skeletal muscle biopsy, we can find ragged red fibers. So we can perform on the orbicularis muscle also. Then we have this pigmentary retinopathy. So it includes NARP, so that is neurogenic weakness, ataxia, and retinitis pigmentosa, so that is NARP. Then MELAS, MELAS, so this is mitochondrial encephalomyopathy, lactic acidosis, and stroke. Then we have MERRF, that is myoclonic epilepsy and ragged red fibers. We also have Kern-Serre syndrome, that is also called Pearson's syndrome, right? So these are all the examples of mitochondrial disorders in the eye. Coming to the diagnosis part. So based on the clinical picture, it can be either classic presentation, so based on the presentation and the pedigree charting, is done at least for 3 generations, and we have non-specific tests. So for the classic features, we can go for molecular genetic studies. And in the non-specific cases, we can check the plasma or CSF levels for lactic acid, ketone bodies, S-carnitine, and urinary organic acids. So if these are not normal, then we have to go for muscle biopsy or respiratory chain enzyme analysis. So at the end, we can perform molecular genetic studies. Okay, so these are the things. We have molecular genetic studies, the plasma levels of these enzymes, which are usually elevated in case of mitochondrial dysfunction, muscle biopsies, and respiratory chain enzyme analysis. So these are useful for the diagnosis. Okay, so the treatment we have, as we have discussed here, is the gene therapy, antioxidants, neuroprotection. Okay, so these are the treatment options available. So we have discussed specifically regarding LHON. So this applies to other disorders also. In the next class, we will discuss regarding the genetic counseling in these cases. Okay. Thank you.